Okay, guys, here we are live in our biological bone masters group, the community of autogenous bone augmentation with the Kücük technique, and you are now live in our hands-on training with colleagues from around the world. They are at the home without to travel. They learn, in the hands-on part how they, create bone blocks, how to create a horizontal bone augmentation, and later in the second part we will work on the soft tissue. Everything is prepared. The colleagues are, amazing colleagues from around the world. There are talented implantologists, and they will become an expert in autogenous and predictable bone augmentation. So maybe they can say to you hello. My friends, say please hello to our colleagues from our community. Look, your friends. You can here, Mario, Kevin, Serif, you can open your camera and look how they're working. It's in Turkey, Iran, USA, Germany, and they're working still on this peak. Or yes, Sadiq Bakro from Canada, from Tehran, very experienced colleague, the master in prosthetic and implantology with 30 years experience, right? 35, sorry, 35. Okay, we cannot hear you, my friend. Open your sound, your voice.
If I say, you will know my age, but I'm saying I'm 67 years old.
Wow, look, he makes the breakthrough with the highest experience of our participants. Thank you for your trust, Sadek.
No, I trust you.
Thank you.
You are the one, only one.
Thank you. If you want to become join to our community with these nice guys, let's speak about your challenge, or you can work still with your concept, with substitutes and membranes. If you are successful with this concept, wonderful. But we have colleagues here, they use user of substitutes, user of solid bone blocks. So they give you experience about the last years about substitutes and solid blocks.
You know, I did almost more than 20 some years of putting block.
Yes.
And what I'm seeing most, I don't say 100%, but most of them that I notice, we have resorption. And resorption mostly in crystal area, which is today we say no bone loss, zero bone loss. Everybody targeted for zero bone loss, but unfortunately with block, always we have this problem. Honestly, I had a lot of membranes. I said, forget it. Only I will use them on my sinus window, and no more. If I had some xenograft, I said I will use it in some part of sinus. The rest, forget it. I returned whatever I had, bone particles, half a price. I sold them. No more. I don't say GBR doesn't work, but this is the last thing we can imagine for bone augmentation, I believe.
Two questions to you. Which kind of colleagues should join this autogenous bone coaching program, and which colleagues shouldn't join this coaching?
You know, to me, like at least guys that they did GBR, they have seen the bad part or good part of GBR.
Yes.
The colleague, at least they place some implants. The colleague, at least they know about soft tissue management. And that is how I believe they should join. And again, somebody can join from scratch, but he has to come with a lot of I don't know what to say. A lot of love to come to this course.
Passion, also passion.
To say,
passion for augmentation.
And patient, of course, patient. They will have a lot of, they will have some complications. They will have opening of their flap. So from the first day, I believe the way you teach them,
yes,
or you will teach them, I think they will be okay. And it doesn't matter if you are periodontist, I recommend this for everybody, oral surgeons, periodontists, general dentists. Today, we know 70% of general dentists, and we know there are a lot of general dentists. Mm-hmm. I can say they place implant 1,000 times better than a lot of periodontists, mm-hmm, because they have sense of, they work as a general dentist, they did prosthesis, and this modality is, I can say it is prosthetic-driven modality. So they have to know the prosthesis also before even joining this program, because they have to know prosthesis. The surgery starts with prosthesis.
And the main problem from some colleagues are, yeah, this coaching is online, is not so, maybe not good for me, I have not input, not benefit. What is your, until now, your feedback or your experience? Could you get all the good views, all the information, what you need for the protocol of horizontal and vertical augmentation? Can you share your experience to our colleagues? Maybe they are struggling to say, oh, I love to one-to-one face training, but give us some benefits, the main 3 benefits of this training for you.
Let me be very honest with you. It is better to be in live class, but there is no difference between now and live class. I don't see any difference. A lot of my own students also, they say the same thing. You are explaining things perfectly. There are everything with high HD, and quality of videos are perfect. The way you explain them is perfect. I think there is no difference between online and online. And also, I said yesterday, I was talking to young periodontist from Isfahan city.
Yes.
He asked me, do you recommend this course for me? I said, of course. I know what they learn in perio program. Honestly, I know. I know what exactly they learn in perio program. When I'm talking about United States,
okay,
when they are graduated from dental school,
yes,
they didn't do more than 100 implants. This is for sure. I'm talking about best universities. They didn't do more than 50 or 60 soft tissue grafting, not as huge as you do in this course. Okay, they do single tooth, they do a little bit. They never do Kazanjian. For sure, I tell you, they do Kazanjian.
One question, Sadek. Many of our colleagues came to us to learn hard tissue augmentation, but they got also a concept of soft tissue approach, soft tissue management. What was your thinking about? You was also one of the colleagues, they want to learn the hard tissue bone augmentation, and you saw different approach like tunnel technique, lateral tunnel technique, vertical augmentation with sinus lifting, different. What was the difference to our trainings?
Let me be very honest. You go a lot of courses, they come and show you, let's say, block. Okay, I did block. Then, what else? What I'm going to do next time? We all know we have a lot of, when we do bone grafting, we release, there will be no vestibule. There will be no attached tissue, for sure. So if somebody doesn't know soft tissue, how he's going to manage it? He's going to call somebody else to say that, hey, I did block, but now I don't know how to do vestibuloplasty. I did block, now I don't know how to increase my attached keratinized tissue. So the beauty of this course is that all are included, especially if you're placing the implants. Though they have to know exactly 3D position of implant. Position of implant is not the buccal, lingual, or mesiodistal. It is vertical also. So here, I believe this course is, honestly, this is, with my 40 years of experience, I'm saying this course the way you do, the way you learn from Dr. Furi, that I know him for many, many years. This course is the perfect final course for anybody who wants to attend. For anybody who wants to attend. I call you middle of night. No instructor, no teacher will answer your phone. I call you middle of night on Instagram, on Facebook, on your private telephone. You know, this is the beauty of this course. This is the beauty of Dr. Serif.
Thank you very much.
Okay, so I will recommend your course. You know, I am telling you honestly, you have not to be famous in Turkey. You have to be famous in United States, in Canada. And I will recommend you to any of my friends, any of group that doing these courses. You have to be, because it's not becoming famous. I mean, it's not a question of becoming famous.
No.
The help you are doing to the colleague, the help you are doing to the community, dental community, you know, you are saving patient life,
right.
and you are saving dentistry.
Yes, we will let dentists have a relaxed life after the work. They can sleep better without to think about the grafting situation after the augmentation, or the one situation will be get a complication or not. So this is stressful life, and with this concept, yes, you know, we saw the regeneration after 4 months of bone, perfect healing. It's not in one case what we try to pick up and show the best case. You can see also, because it's live, our operation surgery, you can see also some irregulation or insufficient bone regeneration, and you can see how we manage this complication during our operation, so that you will also the skills if you have some complication, how you can manage. So you are complete an expert, not only to augment, also to treat complication from your cases or from the colleagues. So you can grow in your area as an expert in short time, because this technique is not using from many colleagues. This is at the moment a small group.
Can I add something more also to my words? That the beauty of your program is, like, you are updated. Let's say dentine, for dentine, the tooth.
Yes.
I believe everybody should put dentine grinding in their practice, because there will be a lot of time they will use the patient teeth for as a bone, as a second source of their bone. So this is the beauty of your program, that you also put that one, which I'm sure a lot of countries, even they don't allow to use this machine in their country, which is sad for other communities, which is sad for our science, which is almost 10, 12 years. Everything is done about that. The dentine is same as autogenous bone. They are sister and brother. So again, thank you for all your information you give me personally. And I will appreciate all my life.
Thank you very much, Sadek, for your sharing your experience and your feedback about our course. And let's continue with our training. See you later, guys, in the next live session for the community of biological bone muscle. Bye bye.